And you're with me, Inga, and it is 7 minutes to 11. Well, did you know that only 2/3 of funding is being used by Australians accessing the National Disability Insurance Scheme? And on top of that, COVID has also had a significant impact. River Knight is the Chief Executive of Australian Communities with you now. Good morning, River.
Good morning. Thanks for having me.
Well, River, the COVID impact, let's talk about that first. What impact has that had on people with disability accessing their services?
One of the things that Australian Communities has really noticed is a huge community disconnect because we've had the official closures of services. We also have those other issues of people not wanting to get into the community because they have that risk of I guess, collecting up a terrible, health risk, which could put them in hospital and could put them at serious risk in terms of not being able to access service providers, because if the person themselves has it, then the service may not be able to want to come and actually work with them because the staff then are at risk. So we've noticed the statistics coming from National Disability Insurance Scheme showing that about 34% of those people, or 34% of the funding that people have, hasn't been used in 2020.
Wow, so that's pretty significant. And if you are someone who has been accessing those services and they've suddenly dried up, what is the impact on your day-to-day life?
So a lot of those services are essential services. So some people need those staff coming into their homes to support them getting out of bed, to support them with activities of daily living, cooking, cleaning, accessing the community, going shopping, all of those really essential things that we all do and take for granted. They rely on those services to come into their homes and still happen. So a lot of service providers, like the big ones as well as the smaller ones in regional areas, really struggle because we can only do what we're allowed to do, and it's a service that simply can't stop.
Isn't it, wouldn't it be concerned, thought of as one of those essential services, though?
It is. So we do get considered as an essential service. However, some of those services that are in place have the added complexity of, if a staff member is suspected of having COVID, they can't go to those people's houses to provide the support. So the problem, especially within regional Australia and in some of the smaller communities, is if a service provider has a suspected contact tracing going on, they then don't have those staff resources to provide the service, which is an essential service.
Is there any way around this? And you're talking about, regional areas where, there are already barriers to access to services because we just don't have the population or the number of businesses that you would in a large centre.
That's true, and one of the things that we are seeing happen is that if a service provider can't go into a person's home, that person then becomes incredibly reliant on family and their greater community, but also then health services. So I've seen quite a number of people that have ended up in hospital that shouldn't be in hospital because the service providers locally just simply haven't been able to provide services. I haven't had the capacity because they've had to wait, the 14-day quarantine if they thought they may have actually contracted it, or they've had contact tracing show that they shouldn't be going in and to work and actually support those people. So Australian Communities is really looking at trying to reconnect people through the events that we're running.
Okay, and so you are running a couple of events. So what are those?
So in Queensland, our big event is April 30 and 1st of May. That's an event coming up where we have up to 200 service providers, but a lot of interaction space so that people can connect and find those service providers. Down here in Brisbane, we would love to go up north, but unfortunately, unless we get some really good backing from the government, it's really hard for us to be able to spend the money and make it up there. So we'll also have hopefully the space for people to connect with service providers electronically, and hopefully they can also connect and get those contacts that might be able to help them out locally.
Okay, so that's the April the 30th, and I guess we'll get more information as that comes closer. River Knight, thank you very much for your time this morning.
No worries. Thank you so much.
Thank you. River Knight is the Chief Executive of Australian Communities. And as you heard him say, that only two-thirds of funding is being used by Australians accessing the National Disability Insurance Scheme. And a lot of that was thought to be due to COVID. So the thing is if you are accessing NDIS, is being aware of what services are available there. So you can have a look on Australian Communities, and they will be holding an expo. It will be in Brisbane, but as you heard that there should be some online connectivity. So that will be at the end of April.